welcome again. I am Obane Kestin and I'm happy to see you. We'll be taking the subject, physical and health education, and we'll be looking at the topic, pathogens, diseases, and their prevention, part 5. And this topic is under the theme, health education. So, by the end of this particular lesson, you should be able to still define non-communicable diseases, explain the nature of some non-communicable diseases, and state the causes, disease factors, treatment, and prevention of the non-communicable diseases we are going to be mentioning in this lesson. So, a quick reminder of what we started with on non-communicable diseases. We say that they are, for short, non-communicable diseases for short are NCDs. So in the course of the lesson, I will be saying NCDs. Just know that we are still referring to non-communicable diseases. Non-communicable diseases are diseases that cannot be transmitted from person to person. So in other words, if Mr. A has this particular non-communicable disease, okay, and Mr. B comes to shake his hand, he's not going to transfer that disease to him, okay? So these kind of diseases cannot be transmitted from one person to another. But we've also said that these kind of diseases are usually chronic, meaning that they are long-lasting or constantly reoccurring. They are diseases that last for a very long time in people. In fact, sometimes they can be lifelong. Now, NCDs include a wide range of ailments. Examples are mental health disorders, to cancers, autoimmune diseases, diabetes, cardiovascular diseases, fractures, hormonal conditions, etc. We can go on and on to talk about different kinds of diseases that are NCDs. Now, these NCDs are the leading cause of death worldwide as they result in more deaths than any other cause. You hear of people having diabetes, cancer, okay, heart issues such as stroke, high blood pressure. We are saying that they are even the main and leading cause of disease worldwide. There are a lot of things that we do as human beings that ultimately lead to the development of these non-communicable diseases. We say that things that we do that lead to them are smoking, unhealthy diets, eating unhealthy diets such as fatty foods, saturated fats, red meat. What we put into our body goes a long way to tell how our body will be, okay? If you eat a lot of unhealthy foods, your body is going to break down someday. But if you also eat a lot of healthy foods, fruits and vegetables, fibers, drink a lot of water, your body is also going to be nourished. Smoking, drinking, alcoholism, all these are activities that we do that lead to these diseases. Then physical inactivity or having sedentary lifestyle, not exercising, sitting in a place for very long hours, especially for those of us that work in offices where we come to our desk and just sit down for the next 8 hours without standing up. Those kind of lifestyles can lead to some of these non-communicable diseases such as cancer, diabetes, heart diseases, and even bone issues. So we say that these kind of things we can do that can lead to healthy mind, healthy kidney, because it's these internal organs in our body that ultimately make us have good health, as it were, all right? So a healthy kidney, healthy liver, a healthy mind, healthy heart, healthy eyes, and healthy lungs, okay, is what ultimately make up wellness, as we can see in this wellness tree. There are some lifestyles that can lead to some of these NCDs. There are also lifestyles that can lead to wellness. These lifestyles are drinking water, having a positive attitude towards life and towards other people around you, being physically active, and eating healthy meals to include fruits and vegetables. So all these leads to healthy lifestyle, while the opposite, stress and worry, physical inactivity, alcoholism, smoking, eating junk food, all lead to illness, as you can see in this illness tree. So that's a brief introduction on non-communicable diseases. We'll be talking about some of them in this particular lesson. In the part 4 of this lesson, we talked about cancer. In this lesson, we are going to be talking about diabetes and sickle cell. In our next lesson, we'll look at stroke and osteoporosis. Diabetes mellitus is commonly referred to as diabetes, and it is a group of metabolic disorders that give rise to too much sugar in the blood, which is actually what we call high blood glucose. When the body is not able to metabolize sugar, all right, it will now cause excessive sugar to now reside in the blood. And that sugar is actually glucose. So it's a disease that occurs due to the abnormal use of blood glucose by the body. The body is supposed to make use of what? Blood glucose for its function. But when this blood glucose is not being properly used by the body, it gives rise to diabetes mellitus. Now take a look at this diagram here. We have a healthy pancreas producing insulin. All right. Now, the insulin in the body actually is produced by the pancreas, and it is the insulin that metabolizes the sugar or the glucose that the body produces. When we eat, okay, the food we eat gets broken down, especially those starchy foods we eat, and the end product is glucose in the body. Now, this insulin comes to make use of this glucose or this sugar, all right, and uses it for its function and all that. But then, when this insulin is not produced by the pancreas, it's going to mean that the sugar or glucose that the body has produced will remain there. It will reside in the blood. There are also other times when the insulin produced is not able to be used by the body due to one or two reasons. So we are going to see that in this lesson. Type 1 diabetes. This is a condition in which the pancreas produces too little insulin or none at all. This pancreas is supposed to produce insulin that is supposed to metabolize the blood glucose. But then, it produces too little insulin for this particular work, or it does not even produce the insulin at all. Now, this usually develops when the immune system destroys the insulin-producing cells in the pancreas, giving rise to a buildup of glucose in the blood. So, this second part is showing us what happens with type 1 diabetes. Okay? The pancreas is not producing insulin, and this is the glucose that has been produced in the blood. Without insulin, this glucose will not be used up in the blood. So it will now give rise to a buildup of glucose in the blood. Now, type 1 diabetes may also develop due to the destruction of the pancreas, which may be caused by disease conditions, alcohol, or even surgery. So the pancreas, if it is destroyed, it means that insulin cannot be produced because it is the pancreas that produces the insulin, which metabolizes the glucose. So when the pancreas has been destroyed due to disease conditions, surgery, or even alcoholism, then it means that there won't be production of insulin as well. Then the blood glucose will remain there and will just build up in the blood, leading to type 1 diabetes. Then type 2 diabetes. This is a condition that occurs when the cells of the body resist or does not respond properly to the insulin produced by the pancreas. So we are saying that in type 2 diabetes, the pancreas is producing insulin, but the cells of the body are resisting the insulin that has been produced by the pancreas. Okay, so the third kind of diabetes is what we call gestational diabetes, and this is a form of high blood sugar that occurs during pregnancy. So this one only affects pregnant women. Now we'll be looking at some signs and symptoms of diabetes. What are the signs that show that someone has diabetes? The person experiences frequent urination, increased thirst. Because the person is always urinating, the person will also need to be replenishing himself with water, all right, because the body is always losing liquid. So the person needs to be taking water all the time. So you see such a person always being thirsty. Another one is increased hunger, and another sign is what? Weight loss. From this image, you can see some of these symptoms of diabetes, how they affect different parts of the body. The system, we have weight loss. Respiratory, the person will have hyperventilation, breathing problem. Then the eyes, the person might experience blurred vision. Then the breath, the person may have what we call smell of acetone. Is a chemical. The smell of acetone may remain in the person's breath. When the person comes close to you, you perceive a kind of chemical in the person's breath. Then we also have gastric issues such as nausea, vomiting, and abdominal pain. And the person will also have urinary issues. So these are symptoms of diabetes. There are other symptoms that may develop, but these symptoms are not specific to diabetes. They can also be there due to another ailment, but it's also important that we mention them here. The person may experience blurry vision, headache, fatigue, itchy skin, slow healing of injuries, tingling or numbness in the feet or toes. Now, what are the disease factors of diabetes? Now, we've said that disease factors are also known as risk factors, and they are simply those things that we do or conditions that we already have that can increase our chance of developing a non-communicable disease. So, for diabetes, some disease factors are obesity. People who are extremely fat will be at a higher risk of developing diabetes. Another one is sedentary lifestyle or inactivity. Not doing anything, sitting in one place. Some people can sit and watch television for 3 hours without getting up. Some people, maybe in their workplace, they can sit for 7 hours, 6 hours at a go. Short lifestyles. Some people, it's not even work. They just sit back at home. They just lazy around. So sedentary lifestyles, being inactive, it can lead to what? Diabetes. This person, as you can see, is already obese. He's already fat. And he has a whole lot of unhealthy food around him. Okay, junk. You can see he has cigarettes on one hand. He's smoking. And you can see other kind of junk meals around him. Okay, this kind of lifestyle can lead to diabetes. Another one is a family history of diabetes. For example, if you've had maybe 1 or 2 persons in your family tree come down with diabetes at some point in their life, there is that high chance that, people in that family may also develop diabetes later on in life. Another factor is too much intake of refined foods. Fatty foods, especially saturated fats, red meat, sugary foods, and beverages. As you can see, some of these things we eat and we think that we're enjoying life. Too much intake of all these kind of foods. Yes, once in a while we can take them, but too much of these things are not too healthy for us because they are junk and they end up building too much sugar in our body, so much that our insulin level cannot even handle, and it becomes problematic. Then another disease factor is high blood pressure or hypertension, and then low levels of good cholesterol in the body can also be a disease factor for diabetes. Then we have complications of diabetes. So these are the complications that can arise from diabetes. Okay, we may have some other issues such as cardiovascular diseases, diabetic ketoacidosis. Stroke is another complication of diabetes. Chronic kidney disease, foot ulcer, damage to the eyes, and even death. Then let us look at prevention of diabetes. So some of the actions we can take to prevent diabetes would simply arise from what we talked about in the disease factors. So maintaining a healthy diet, engaging in regular physical exercise. This would help also maintain normal body weight. So it will help to put off obesity. Avoiding the use of alcohol and tobacco. Limiting the use of sugary beverages. Yes, sometimes we have the cravings to take sugary things, but we must limit their use. Eating less red meat and saturated fat from other sources. So we must limit our intake of red meat, saturated food, junk, all right? And we must engage in exercise. Physical activity is very, very important. In fact, physical inactivity leads to a whole lot of diseases apart from diabetes. So when we engage in exercises, it helps to keep us at a normal body weight and lay off some of these diseases that we're talking about. Then treatment of diabetes. Some ways to treat diabetes would include the use of insulin injections. Now, this one would work for type 1 diabetes. Remember, we said that type 1 diabetes is when there is little or no insulin production from the pancreas. So, insulin injections will be given to such type 1 diabetes. Also, we have the use of weight loss surgery, especially for patients with obesity and type 2 diabetes. Okay? If one can afford a weight loss surgery, it would help to remove the excess fats in the body. Carrying out pancreas transplant. This would work for patients with type 1 diabetes who have severe complications of the disease. Remember, we said that sometimes some lifestyles, okay, or certain surgeries would have destroyed the pancreas where the insulin is produced. So a pancreas transplant may need to be carried out for such cases where the pancreas has been destroyed. Then another one is putting efforts to maintain a normal blood sugar level. So we must always try to maintain normal blood sugar level. There is also a special equipment that people use these days to check or monitor their blood sugar. When you have such an equipment, use it to monitor your blood sugar. When you see that it's going high, you check yourself, check what you're eating, and engage in exercise to keep it at normal. Eating healthy meals filled with lots of fibers and whole grain foods. Also meals that contains lots of fruits and vegetables. Very, very important. Then exercising. These are ways that we can put effort to maintain normal blood sugar. Exercising, losing weight. Of course, exercising helps us to lose weight. Then using proper medication. Remember that we said some medications can even lead to destruction of this pancreas. So we must use proper medications and avoid self-medication as well. Now let's look at sickle cell disease. Now, sickle cell is an inherited disorder of the hemoglobin. So this goes to tell us that sickle cell is inherited. It's an inherited disorder of the hemoglobin. This hemoglobin is simply the oxygen-carrying protein found in red blood cells. The oxygen-carrying protein found in red blood cells. Now, sickle cell results when a person inherits 2 sickle cell genes from his or her parents, one from each parent. Such a person is referred to as what? A sufferer. So we have genotypes AA, we have AS and SS. People with this genotype, SS, are known as sickle cell sufferers. Now, what gives rise to this kind of genotype? When parents, let's say, one has genotype AS and another one has AS, okay? There is every possibility that they can produce a sufferer, a sickle cell carrier. Because when cross combination is done, there is a possibility that they may produce an AA, okay? Now, there is a possibility also that when you cross, they can also have an AS, a child with this genotype AS. This simply means that the child is what? A carrier of the sickle cell gene, but this child is not a sufferer. So there's also another possibility that they can have another AS, but there's a possibility that they can have an SS child, okay? A child who would be a sufferer of what? This sickle cell disease that we're talking about. And it can be one child, it can be 2 children, it can just happen randomly, okay? So there is no hard and fast rule that the first child must be an AA and the second one an AS. So an SS can come at any time. So someone will become a sufferer of this sickle cell when the child inherits 2 sickle cell genes from both parents, one from parent A and the second one from parent B. Such a person, as we said, is what? A sufferer. Now, healthy red blood cells are flexible and disc-shaped, as we can see in this image. This is a healthy or normal red blood cell. But the red blood cell of someone with sickle cell disease are more stiff and curved, as we can see in the second diagram of a red blood cell. You can see that this one is what? Curved, shaped as what? The old farm to sickle, and that's where it got the name sickle cell. You can see that this blood cell is abnormally shaped. It has the shape of what? A sickle. Now, the red blood cells within a short time become misshapen. This means that they are contorted into the shape of what? A sickle, and they eventually get broken down. Now, these red blood cells break down because the sickled cells are prone to rupture. Remember, they are no longer normal, okay? They are sickled, they are misshapen, they are contorted. So they are very, very prone to rupture or burst. And when all those sickled red blood cells have ruptured, okay, they cause a shortage of healthy red blood cells. Imagine that there are several healthy red blood cells, and then we have plenty of them, being misshapen, okay, or rupturing, dying. It will lead to what? A shortage, a decrease in what? Healthy red blood cells. Now, when there is not enough red blood cells to carry adequate oxygen throughout the body, it leads to what? Sickle cell anemia. Now, because those sickled ones are always breaking down and dying off, we're saying that the amount of healthy red blood cells in the body will be very, very little. And this amount remaining will not be enough to carry adequate oxygen throughout the body. And now this will now lead to what? The sickle cell anemia. Also, the sickle cells sometimes block the flow of blood, causing tissue damage, organ damage, and pain, leading to the sickle cell crisis. So when these sickle cells are also blocking the movement of blood to other parts of the body, what happens? Those areas of the body or those organs of the body that are no longer receiving enough oxygen will start dying or they get damaged, okay? And this is what we refer to as sickle cell crisis. Now, this disease, sickle cell disease, lasts through the lifetime of an infected person. It has no cure, so it lasts through the lifetime. Someone's genotype cannot change from what it used to be to another. So once someone has that genotype SS, the person has it for life. The disease can only be managed, but it cannot be treated. Signs and symptoms of sickle cell disease. Most symptoms of this disease are as a direct result of the abnormally shaped red blood cells that block the flow of blood. So these symptoms are anemia, which is what? Lack of blood in the body. Episodes of pain. We say that such sufferers will always have what we call sickle cell crisis. Okay, they're always having episodes of pain due to lack of proper circulation of oxygen to other organs in their body. They'll also be prone to frequent infections, okay, because their immune system will always be down. So any infection that is in the air, they will easily catch it. They also have painful swelling of hands and feet, delayed growth. Some sickle cell sufferers, you see them, they don't grow healthy like other children. For example, if you see a 10-year-old sufferer and another 10-year-old normal or healthy child, you see that the sufferer would have what we call stunted growth. He will not grow as fast as what his or her peers. Then we also have vision problems, and they are always fatigued, they are always tired. Now, the disease factors of sickle cell disease. What are the things that can give rise to this or increase the chances of sickle cell disease. We've said that the only disease factor for sickle cell is that both parents must carry a sickle cell gene. Remember what we said, that when an AS and an AS come together, okay, now this S is what? The sickle cell gene. And the parent B is also carrying a sickle cell gene. So this is the only criterion for a sickle cell sufferer to be born. Okay, so if the match is between the sickled genes from both parents, it will result to a sickle cell sufferer. Complications of sickle cell disease are acute chest syndrome, stroke or pulmonary hypertension, leg ulcers, organ damage, gallstones, and blindness. These are all complications. They may be present, they may also not be present, especially if the disease is well managed. Prevention of sickle cell disease. This disease cannot be prevented once a person is already a sufferer. So once a child has been born a sufferer, okay, it means that we cannot prevent the disease anymore from happening. However, people can reduce their chances of giving birth to sickle cell sufferers by, first of all, knowing their genotype and avoiding sexual intercourse with any other sickle cell carrier. Treatment of sickle cell disease. Okay, so as we say, there is no cure for this disease, but treatment is aimed at managing the individual symptoms of the illness as they arise over time. Something that can be done to manage the illness include taking prescribed medications to help with pains. Some of those pains have specific medications that are given to reduce the pain. Sufferers must make sure that they are taking those prescribed medications and they are obeying doctors' instructions as well. Another treatment can be taking blood transfusions to replenish the amount of normal red blood cells, especially as the abnormal red blood cells are rupturing and dying. Then in rare occasions, another treatment may be to have a bone marrow transplant. So these are the treatments that are available for sickle cell sufferers. Now, we have come to the end of this lesson. We'll take a quick summary of what we have learned. We say that non-communicable diseases are chronic diseases that are not contagious. They cannot be transferred from one person to the other. Some non-communicable diseases we've mentioned are cancer, diabetes mellitus, sickle cell disease. Diabetes is a group of metabolic disorders that give rise to too much sugar in the blood. And then we have type 1, type 2, and gestational diabetes as types of diabetes. Then we also looked at sickle cell. We said that sickle cell disease is an inherited disorder of the hemoglobin in the blood. So we'll just take a few questions to help us with what we have learned in this particular lesson. Now, question 1. Which of the following non-communicable diseases is inherited? A, sickle cell anemia. B, osteoporosis. C, kwashiorkor. Well, our answer is A. From our lesson, we learned that sickle cell anemia is an inherited disease. Another question. The disease that occurs due to the abnormal use of blood glucose by the body is known as A, cancer, B, diabetes, C, stroke. Our answer is B. From our lesson, we've learned that diabetes occurs as a result of abnormal use of blood glucose by the body. So with this, we have come to the end of this lesson. I'll see you again in our next lesson when we'll be talking about stroke and osteoporosis. Thank you for staying with me.